existing dollars at the federal, state, and local levels to create greater access to quality after-school and summer programs?
Well, I think at least part of it comes back to, what I already mentioned. We need to start by engaging people that are already doing this work, whether they're affiliated with a well-established nonprofit organization like the Boys and Girls Club, or if it's, just a neighborhood daycare that's run by some, heroic senior citizens. We need to start by engaging them and asking them first and foremost what they need. I will tell you though, as we're talking about how to leverage federal and state dollars, the one thing that I hear over and over again, particularly with the federal government, but it's true for the state as well, it can be really hard and downright confusing, even for incredibly smart, diligent people, to navigate some of these grant applications, to figure out how you really maximize your competitiveness. There's work that we can do at a state level to simplify these forms to make sure they're going into these areas, and there's technical assistance that we can and should provide to help people navigate the federal forms that a governor and state government doesn't have the power to simplify. I think those are simple steps that can unlock a lot of progress and give people that are already working hard and making some progress the extra resources they need to scale their impact and to reach more kids and to change more lives.
All right, we're ready for the third section, the healthcare questions. Today, 96% of children in Arkansas have health coverage, largely due to the Our Kids First program. Up to 300,000 adults have access to affordable health coverage because of the state's Medicaid expansion program, Arkansas Works. Question number one, how will you protect health coverage for children?
Well, the first two things I would say. One, to me, the progress that we've made, and it's been bipartisan progress over a long period of time, to expand health insurance to kids, it's one of our proudest achievements. And I think it has to be one of the top priorities for any governor and any legislator to protect. Two, our biggest threat to that often comes from the federal government. Just last year, Congress more or less forgot to fund the CHIP program, which helps fund our, children's insurance in Arkansas. And we need to make sure that whether we're voting on federal officials or whether we're voting on state officials, we're gonna vote in people that make it a top priority and raise the alarm when we have people letting us down and jeopardizing that funding. That has to be something we want people to know. The last thing I would just say, 96% is extremely impressive. It is. We should be proud of that. But there's thousands of kids in that last 4%. And I would venture to say they are some of the most vulnerable children in this state. And so we need to figure out how we reach them as well.
Question number two, what is your position on providing affordable coverage to adults who are low-income earners?
Well, first of all, I just have to say, we are living in the richest country in the history of the world. And I think, given that, we should see and treat healthcare as a right in this country. Having said that, there are practical implications. As a responsible candidate, as a responsible governor, we have to acknowledge how are you going to get it done, even in a rich country, because we do have budgets to meet in this state. For me, I think the way that we start to make progress on that, we have expanded Medicaid, we have expanded coverage to hundreds of thousands of people in recent years. Over the last decade, we've made it illegal for insurance companies to discriminate against you if you've had cancer, diabetes, or some other pre-existing condition. We need to stop haggling over this process. We need to celebrate it. We need to stop redebating it every year, and we need to move on to the more important and fundamental challenge in healthcare, which has already been raised, which is how do we get the costs under control? How do we make health insurance more affordable? There are many reasons that I'm privileged to be married to my wife, Dr. Melanie Prince, who's here. She is an incredible surgeon. She is also a business owner. She has built a medical practice in recent years. And I can tell you, as she has worked to expand health insurance to her employees, every single person in that office makes a living wage. Way, way, way more than minimum wage. But I can tell you that many of them, all of whom are healthy, are struggling more and more every single year to pay their healthcare premiums. And there's no sign of that trend diminishing. And in part that's because we're not even focusing on it. We're debating progress we've already made. We need to celebrate it, move on, we need to tackle the problem of rising healthcare costs.
And finally, question number 3. How will you ensure that all children and families in Arkansas have access to high-quality health care?
Well, again, I think that we've been shooting ourselves in the foot when we've been having this annual debate. We have made so much progress at the last decade, from the federal level to Little Rock on down. And like every law that the United States Congress or the Arkansas legislature will ever pass, the laws that we made are imperfect. But we need to focus on the things to improve and stop relitigating the things that have been undeniable progress, that have expanded justice and opportunity and equity to our most vulnerable citizens. To me, this is about figuring out how we lower the costs. And I think the greatest opportunity that we have is starting with prescription drugs. There are just outrageous practices that are going on right now in this country. We have laws that prevent our largest purchasers of pharmaceuticals, Medicare, from even negotiating their prices. We allow them business practices where they can buy out lower cost prescription drugs, safe prescription drugs, to keep them off of the market to increase their prices. These are things that we need to be electing representatives at the state level and in Congress. We need to be sending people there that are going to do something about that, because we're all losing when that happens.
All right, that concludes the questions. Thank you so much for your answers.
Thank you. It's an honor to be here.